you ever had the journey meetings right up the middle
Welcome to the Psychic Guys. Our discussion tonight is about developing psychic abilities and how to do it. We're joined by Debra Lynne Katz, who is the founder of the International School of Clairvoyance. As well as being a remote viewer, clairvoyant, medium, and energy healer, Debra is also an active parapsychology researcher and the president of IRVA, the International Remote Viewing Association. Welcome, Debra.
Oh, thank you. Great to be here.
So you've taught clairvoyance and remote viewing and mediumship, right? Do you teach all these skills? Can anyone do this? And is there any danger?
Yeah, those are two big questions. So first, can anyone do this? I would say just about anybody. I would say that there's a spectrum that you see of most people are somewhere in the middle, and then there are people that are way on the end of super talented, and then on the other end of the spectrum, once in a while you might find someone who really struggles when they're going through training. But basically, anybody that is really working at it, some it just comes, it's already there, or it's a lot easier, or it comes more naturally. But I found that anybody that's really willing to stick with it and keep working at it and coming at it from different angles and approaches is going to be able to access their abilities and gain some level of control.
So what about the dangers then?
So the dangers, well, it's just like anything else in life. If you have a tool, you can use that tool for good, or you can use it for evil or for selfish purposes. And so that is just part of the human condition. I would say when people are first opening up, they will become aware not just of the information that they want to seek, but sometimes they become very sensitive of everything around them. Sometimes it's sensitive to even the contents of their own subconscious that they weren't aware of before, or they become aware of like some of the different games that people have been playing around them. So new realizations of like where they were cut off from knowledge before, that can create a lot of inner turmoil. So that can happen when people are first starting to open up and learn. And then also, I do believe that as you become more sensitively aware, and especially in terms of things like the spirit world and other dimensions and things like that, you do become kind of like a beacon. It's like you're suddenly this flashlight, and other intelligences can see. They're aware of you, and they're aware that you're aware of them now. And so that can cause you to be more of a target. So, it's kind of, I look at it like on the one hand, a lot of times people will learn new techniques for protecting themselves and learn how to create boundaries. I mean, I think that's essential for anyone that's developing their psychic abilities in any way. That's always, I require my students to, especially like in my clairvoyant reading classes or mediumship, to learn protection tools and how to separate and get their energy back after they're doing their intuitive work. But the downside is that as they're learning how to set those boundaries and protect themselves at the same time, they're becoming more and more open. So, it's kind of and more attractive to these different energies around. So yeah, it's a little bit complex.
Yeah, I mean, all of that rings true in my experience. We did a show a couple of weeks ago with Duncan Barford called Psychic Terror, and I'll link to it up in the thing, which is all about, the way these things can go really wrong when people kind of come into contact with weird psychic stuff and take it too seriously or take it at face value. But let's not dwell on all the scary stuff, because we covered that a couple of weeks ago. People can go watch that show if they want to. I think recently you've been looking at physical mediumship and healing. What did you find there? Could you tell us the backstory to that? Because this is like, as a remote viewer, this is way out of my wheelhouse, psychic surgery and stuff. So how did you get into that?
Sure. Well, basically 28 years ago or so, I moved to the Philippines. I left my job as a federal probation officer and I moved to the Philippines and spent almost a year there studying with the faith healers and the people who call themselves psychic surgeons. And so I would just go from healer to healer and just spend time there while they were doing their sessions with people. And so I observed like hundreds of different healings and psychic surgeries and received them myself and had a lot of crazy experiences for sure. And so then when I finally came back and out of all of that, I still stayed with energy healing, but didn't, there was a lot of both light and darkness there. And so I just kind of left all that behind. But most recently, maybe now about a year and a half ago, Helena Wabe from IONS, she's the president of the Institute, for IONS, Institute of Noetic Sciences. She received some funding and called several parapsychologists together who were interested in physical mediumship. And we had a symposium for a couple days, and we each had to take on a different topic. And so my topic was on physical mediumship and healing. And I started to research it. And I found what I basically did was researching the best studied and best evidence for physical mediumship first and foremost. So I took like 10 mediums that are considered by researchers to have had the best evidence for physical mediumship. And for those who don't know what that is, that would be either during like a seance or sitting, but sometimes in other scenarios too, like there would be incidents of levitation or of manifestations of partial body parts or full body. There would be a direct voice where not only is a spirit speaking through a medium's body, but there's like a disembodied voice speaking to people, like sometimes for like 30 minutes. Levitation, apportations where just something appears that wasn't there before. And this sounds like so outrageous, but it really was very well studied by many, many psychical researchers, and in particularly through the Society for Psychical Research in the UK. A lot of these cases were in the UK, but some in America. So anyway, what I did was I took those cases and with individual mediums, and then also some groups like the Skull group, who you may be familiar with, the Skull experiment. That was, some of the best evidence there. A group that was just receiving like an insane amount of communications and having this phenomenon. And so I went and then I looked to see in everything that was written and published, incidents of where healing was mentioned, because I wanted to see like how prominent were incidents of healing within these different seance settings. And I found that there was like healing in each incident, even though it wasn't like that wasn't their main focus. I mean, their focus is to do emotional healing for people who've lost loved ones, but not like where they were going to try to heal the people sitting there. But nevertheless, there were lots of spontaneous cases within the seances. And the most interesting thing to me that I found was that in each case, there would be a spirit that called themselves a spirit doctor, like they might have been like a physician when they were alive. In one case, there was he had been an eye surgeon when he was alive. And so these spirits are coming through and like they manifest like in the flesh, or they might like channel through someone, but then they'll move to the people and do healings on them. And there were like lots of anecdotal stories where the people got better. So I thought that was, and also like, they also kind of taught you things like and the spirits in spirit form who were doctors, they would meet up with other doctors, or they would like go to hospital. They said that they would go to hospitals and then like help the doctors who wanted to like believe that they were just doing the healing of their patients themselves, but that they would help them. And then they would also, they talked about how when they choose a medium to work with, and this gets into the development, which I thought was interesting. There was like a lot of corroboration of this, that like the spirits would actually be working with the person for years before they actually started to like channel through them or manifest through them. Like it took a long time, they said, to actually prepare the medium in order to be able to like handle like that amount of energy and things like that.
What were they actually doing? What change was affected in the medium? Do you know?
Yeah, I've thought a lot about that. From there wasn't a lot given on that, but it seemed like they had to physically, and when I say maybe it would be metaphysically, like somehow changing the structure of their energy field, or even their brain, like they had to change something up in their brain. And then they had to change like kind of the way they thought, the way they perceived life. So it seemed like both through their perceptions, and then just kind of preparing them like an openness for this work at all, because some might not even know what it was, but so that like the spirits were already like choosing them before they even knew that they were going to be doing mediumship. Things like that.
It's funny you mentioned that they went and helped hospital doctors. I remember hearing a near-death experience account a little while ago where the person had some sort of spinal or brain injury, and they were in surgery, and they were floating in the ceiling somewhere above the body talking to these energy beings. And one of them said to the person who was having their ND at that point, "Watch this," and did something to the doctors. The body kind of was flailing about, and the surgeon there just had no idea that this whole weird non-physical drama was playing out. Just reminded me. Daz, you've recently done a project with Future Forecasting Group about one of these healers, haven't you?
We did, yes, and we came up with some good results on that. And I've encountered this kind of stuff in my kind of past as well. I've got very close at one point in my classical psychic training to being one of these people that would allow a walk-in, I guess you'd call it. So I was being prepared to accept the non-physical body of one of these people through me in a psychic circle. And going with what Debra said, it literally took months and months and months. And I don't even know what the preparation was, but they kept saying, there had to be this preparation process. And I could feel metaphysical changes going on inside me during this change process, but I couldn't exactly tell you, I couldn't write down and tell you what that process what it entailed. But I could feel it as a progression each month that we were doing this, because we met twice a month for many years. I could feel that it was getting very closer and closer and closer to being able to physically manifest, one of these life forms. But I'm afraid I ended up leaving the circle group before I attained the final go of being able to do that.
Yeah. How did you feel about that? As far as, did you wish you had gone through that process, or were you glad that you stopped it?
Yeah, I wish I probably had gone through it, but it's like remote viewing, really. I guess it's a acclimatization process or a muscle memory or something. You have to go through a long process to get there. It was very close. I have to be honest, there was probably one or two points where I could feel the other life form virtually within me, because you kind of move you move the non-physical part of you kind of like to one side to create a space for the other thing to come in. Mm. And when I could feel the other thing, almost like one leg inside my body kind of taking space, I have to be honest, a couple of times there I did have a bit of a panic and probably aborted the procedure, because it is, when you can actually feel something like that, and it's very hard to put into words. It's quite a shocking feeling to have.
Yeah, definitely. Yeah, and it is so much about letting go and being open to that process. And yeah, I have to say for myself, even though, I also look at mediumship as on a spectrum, like, where what you're describing is the far end, but then there's, mental mediumship over to the other end, or just even where you're using your clairvoyance to tune, and some basic telepathy to tune in. So there's a whole spectrum. And I'd say where I'm at with mine is, somewhere I'd probably say I'm like about 75% over, but haven't taken that like 25% of what you're describing. And when I teach mediumship, I'm also, not going there because I haven't gone there myself. So I'm not trying to bring people there, but I help them to, understand what that is. And some people are, just naturally, that like they've just been channeling their whole life. So some people, even as kids are, doing it to that level. So when they get into training, it's like, bam, they're right there. They can't even help it. It just, or maybe the spirit just takes over. Because there was definitely in my research of the mediums, I came across that too, like Daniel Hume, or Home. I always forget how to pronounce it. Home. He would just, as a teenager, like he would have manifestations happening everywhere, like furniture just like swirling around his aunt's house, who he was staying with, and she even kicked him out because she thought that he was doing the work of a devil. And he was like, sorry, I don't know what's going on. But his mother had died early, and she was very involved as one of his guides. So there would just be things flying around all the time. But he would just be out walking and just suddenly like collapse, and he'd be taken over by the spirit. And, he was known to be like sick his whole life, but he could have very well been both like having, seizures, but also it was clear that he was channeling, because he'd get all this information, like, and something would come through and say, you have to go over to this next village right now and find this guy's house and go talk to that guy. And, someone he didn't even know, but if he resisted, he wouldn't get better. And then as soon as he said, okay, I'll do it, then he could stand up, and he went to the village. And then they're like, yeah, we were waiting for you. We needed you to heal our son that's dying, or something like that. So
I mean,
there's
this thing is very coercive. This is not cool, treating people like that, is it?
well, in that case, and I have to say, I have a guy I've been talking to from China who has been doing personal research into epilepsy and possession, because he has epilepsy and his other family members do. And he has been documenting like hundreds of hours of where he films the person having an epileptic seizure. And then he's developed some kind of process where they interview the spirit while the seizure is going on, or maybe the seizure is like caused while they're starting to like interview the person versus the spirit. And then he says that he's come up with a process to help like get rid of the spirit. But before they get rid of it, the spirits have given all sorts of information about the afterlife, and he's documented it. Like he's got this huge database of like all the different descriptions of the afterlife that these spirits have given him. So it's pretty interesting. But it's also a little scary. Like he sent me some of the videos of the people having their seizures while they're being like interviewed or kind of depossessed. And there is something kind of disturbing about it. And I tried the other night, I was like, I think I'll just kind of try to psychically tune in and get an understanding of what's happening here. And even as I started to, like, I got these massive vibrations, like waves of energy going through my body. And I was just like,
How you build that?
But I don't think I'm gonna.
So what's the connection here between the epilepsy and the spirits, does he think? Is this like the epilepsy is caused by the spirits, or it's pre-existing and it's exploited by... And I want to add as well, I wouldn't take their word for it about the afterlife. if they're trying to possess people. It sounds like that.
Well,
What you want to rely on.
yeah, exactly. In fact, he said, I saw kind of like a write-up of the procedure of like what they learned as they went along. And there was a phase where they were believing everything that they were being told. And then they realized, oh, spirits can be manipulative and not honest. So supposedly he found a way around that too. I don't really know. I'm supposed to interview him for another show, but I'm not sure if that's gonna happen until maybe he publishes some research or so. I have to have a talk with him, but it is really fascinating. I definitely, when I was about 10 years old, I had for about a year, I was having night terrors where I would pretty much just I would be laying in bed. My twin sister and I had bunk beds, and I was on the top. And every night, like I would kind of I'd be laying there, and suddenly it was like I saw something come through the window. It was kind of like this, like if you ever saw the old McDonald's commercials with the Hamburglar, like it was this guy dressed in black with this black hat, and there would be a guy like that, and he would float into my room. And the next thing I knew, it was the morning, and I was trying to wake up, but I was paralyzed and I couldn't talk. And it would take like about 10 minutes before I could finally move and scream out. And this happened every single day for like about 8 months or so. And my mother like took me to like psychiatrists and psychologists and finally a sleep lab. And they said that I was having seizures in my sleep, like during that period. And they actually put me on Dilantin, anti-seizure medication. And they said like when I hit puberty, it would probably just go away. And it did. Like I pretty much stopped. Every once in a while, I might still have something like that, but hardly ever. So I always felt like if you ask my mother, she's like, yeah, you had some form of like, seizures and, it's total medical condition, nothing else. But I've always been like, well, why did I see that thing floating into my room? Like even at that age, I felt like something was trying to like get into my body or somehow was doing, something in relation. So, and over the years, I've really seen like I really do believe that there's this dual, we call it a dual diagnosis of like sometimes mental health issues and possession at the same time. Like it's not just mental health or psychological or cognitive, but it's not just possession either. So, those working together. And I think that's why it can also be, confusing because people are usually just looking for, one of these that are going on. And I think they can happen hand in hand. But
yeah, and I think it leads to disagreement as well, doesn't it? Or kind of both sides not understanding each other because you've got the physicalist medical establishment that's like, oh, it's brain chemicals, you just need to take some more chemicals and the demons will go away. And then you've got the really woo-woo people who are like, and it's all demons. And actually, maybe that person was psychologically in a bad way and that's what made them vulnerable to this thing. And you've got this feedback kind of situation going on is difficult. And the ethical side of it's very difficult as well, right? Isn't it? How on earth do you treat that in an ethical way? I don't think we're anywhere near cracking it.
Well, and if something metaphysical is going on, doctors, most psychologists, psychiatrists, there's no way for them to tell, unless they start to experience it themselves or they have training in these areas, which a lot more do now. I have a lot of students that, are a lot that are psychologists, therapists, some occasionally that are medical doctors or surgeons. So, I think that's so important. But the nice thing about what we do is that not that we're going to understand everything that's happening, but we may have the best shot at least to tune in and see what is going on with this person. So if somebody, whether they want it as a structured remote viewing session or some kind of reading, if they don't even tell us what's going on and we tune in and then we get a sense like, oh, there is this, energy, maybe it's coming from another person, maybe it's coming from a spirit, maybe, no, like you just seem like there's some mental illness here. But, we have the best shot of at least getting some insights into what's happening, more so than everyone else in their life who's just telling them that they're crazy. So someone comes to me like saying that they've been experiencing something like strange or disturbing, like I want to keep a total open mind that it could totally be a medical issue, psychological issue, or, totally spiritual or combination. And, sometimes people are not very discerning either. They just make up their mind of what it is. And, they're like, this is what's happening, help me. And it's like, okay, well, I know you think that's what's happening. I'm going to put that aside and let's see, what really emerges here. I've got a lot of clients like that.
That's good to hear that you've got people in the sort of psychology and psychiatry fields getting into this, because I think there really needs to be crossover between the two fields, because psychiatry is just stuck, isn't it, really? It hasn't really made much progress on what are the causes of these things. All we've got is the DSM with lists of symptoms and pharmaceutical drugs that don't address the underlying problem. Not that those are always a bad idea, but I think a lot of people could do with being listened to and having some metaphysical help rather than just being kind of anesthetized this way.
Yeah. Yes, definitely. And to have doctors or nurses or psychologists train in these areas, it really makes a big difference.
I mean, another option, right, is to just have people like us on speed dial, so that you can, but it's having practitioners who are like open enough to the possibility of these things, and how do we kind of reach those people so that we don't have the problem of medical ethics as remote viewers, and we can provide the medical professional the information and they can do what they will with it within, that established framework. Because I've done this kind of thing where, as you say, you can identify that there's some woo-woo going on, there's no woo-woo going on, this is just childhood trauma and conversion disorder, if you like, or sometimes it's ghosts, or whatever, right? And for them to be able to pick up the phone and get that cleared up, I think would be a great service. I don't know how we're going to provide that, but
that's such a great idea for those professionals to get in touch with us and get some insights, and then they can be the ones to interface with the clients on their own terms, but just to get some extra input. Because
I would like to be able to help people in that way, but it's just an ethical and liability minefield, and I'm not going to train as a therapist. And even if I did, it would still be a liability minefield, because then I'm doing all this weird stuff. So for us to find a way to bring practitioners into the medical fold, I think would be really great. But
I
put out some feelers on that, so we'll watch this space.
Well, and I think, to that effect, like one thing I've done over the years is offer scholarships to, I've offered scholarships both to like medical doctors and to other, they may be the ones that least need it, but, whatever you can do to encourage them to get into, training themselves. I think that's important. I've also offered scholarships to researchers, like academic parapsychologists, who just so that they would be doing the work themselves instead of just studying these topics. So, I just think any chance we could get for people to, tune in themselves and know that they have other ways of being able to understand what's happening with people. And, again, it's not like, I don't think anything we ever do psychically should be the definitive, answer to what's happening. We're just, giving like, potential leads or clues or, some insights here or there. And, that should be taken with all sorts of other information as well.
Yeah. Before we move on though, Debra, you studied these psychic surgeons. Did you actually see any successful, what I would class as like the traditional psychic surgeries, where you see maybe some blood clots, or do you know what I mean? I've seen videos in the past of things kind of look like they've been removed from someone's body, but without any physical scalpels and stuff.
Oh, absolutely. That's what I was observing. I mean, there was just like blood squirting everywhere, like constantly. And I had them and I received them, and some of them I did become aware that the people were faking it. In fact, my I don't know if I should say this online, but I did pretty much in my article that was just published in the Journal for Society of Scientific Exploration, or no, it was the SPR. It was in their journal. So my article on physical mediumship and psychic surgery, I revealed this anyway, but my son's father, who I met in the Philippines, he was an acupuncturist. He didn't do psychic surgery. He was very against it, and I didn't understand why, especially since that's what I was there for. But then after a while, I found out that even his brother was a fake psychic surgeon. So my son's uncle is a fake psychic surgeon who travels around Poland and other places. Now, supposedly, he's also doing like legitimate energy healing too, but feels like that's necessary to open up people's minds or to to get them to believe healing's happening. But I believe that's just an excuse to, be paid more money to, be invited places. So there was definitely some of that. And, that was disappointing because there had been some cases that, I thought were legitimate and then found that out. And my attitude is, even just one time someone fakes something, like, you can't trust it again. Like, this is just so sensitive. Like, it's never okay. It is, if you're trying to heal someone, you're trying to read someone, do a session, whatever, if you're not successful, then you just have to say, I'm not successful. You can't, there's no excuse for faking. And but I will say I had some experiences that I'm quite sure were real, and a couple of them I was involved in doing, in helping out, where the one I always come back to, like, if nothing else, which there's a lot that I totally believe were legitimate, but if nothing else, the one thing I hold on to is I had been observing this one healer named Brother William. He was known as the kangaroo healer because he would have 2 beds and he'd have like hundreds of people there at this little like outdoor healing clinic that you had to like hike down a mountain to get to. And he usually didn't have some of the other healers that are well known, like they're primarily healing Europeans and Americans. But this healer in general, like, it was just poor Filipinos and like 300 people a day or so. And I would be just standing right next to him. And one day I was just standing there kind of meditating, because I would try to like look at the energy of what was happening in addition to, seeing with my eyes. And he gestured for me to go get a tweezer that was hanging off the wall. And it was this big tweezer. And I was like, okay, this is weird. But I went and got the tweezer and handed it to him. And he had his hands on the woman's chest. And he opened up the chest. And like, I'm looking at an open chest with like the stuff in it, like I'm looking inside someone's body. And he had just taken his hands and went like that. He didn't use a knife or anything, but like now her chest is open. And then he gestured for me, and he was like kind of putting his hands inside, and something was kind of like, you could see it. And he's like, tumor. He spoke a little bit of English, and he's like, tumor. And then he's like, you take out. And I'm like, what? I'm gonna take this out with a tweezer? I was just like, no, and absolutely not. And he's like, yes, you must. And he's holding the body like that. And so I grabbed the tweezer, and while I had the tweezer, I went inside and pulled the tumor out, and it was attached to other tissue. It wasn't just like this thing lying there. Like, and I was like, oh my God, what if I pulled out the wrong thing? But no, I pulled it out, and then he took his hands away and her body closed up. And she got up and smiled and walked away. So, that I know I wasn't delusional. There were multiple people, like, probably at least like 20 people standing right there observing the whole thing. So that's the one thing I hold on to. I know that. And yeah, pretty crazy stuff.
Yeah, that's pretty amazing. Yeah.
Yeah, I still have all my pictures from that time, and even with me laying there and there's like blood everywhere, and it was fun going through customs where they opened up my suitcase and they see like all these bloody bodies lying there. And fortunately, one of the customs agents, because this was still in the Philippines when I was leaving, he was familiar with psychic surgery and was like relatives of one of the healers. So that got me through. I don't know what would have happened if U.S. Customs had seen those pictures. They would have thought I was a mass murder cult or something like that. Yeah, pretty crazy. So yeah, it's interesting too, like talking to you guys as remote viewers, and this is just I really compartmentalized so much my other work apart from remote viewing. I think when I first started training, like maybe about 14 years ago or so in remote viewing, it became really clear to me that at least at that time there really wasn't like an openness or acceptance of other types of modalities. So I just kind of, put this dividing line at the time and looked at myself as, okay, I'm just a brand new student to remote viewing. I'm going to forget everything that I've learned, not like outside of this arena, but when I'm in a class or, talking to other remote viewers, I'm really going to just let myself be brand new here and develop in this area. And, that worked out pretty well. But I think, just the fact that we're talking about these topics right now, it shouldn't be, well, I still like the idea that we can, when we want to, we can say, okay, I'm just doing, a straight standard remote viewing session, per scientific protocols, and, we can do that. And that's what we're doing now. But, just to not have to, hide the fact that we do other work or, have it be seen as somehow, not valid or helpful. How do you guys feel on those lines?
Well, I've never experienced it, so it's just one of the many parapsychology topics, which to me is really interesting, but I got nothing to go on. I'm not a researcher of psychic healing or surgery or energy work or anything. I'm very much primarily a remote viewer, so I do find it fascinating though, because I think it sheds some light on the mechanics of what's going on with the subtle bodies or the consciousness field or whatever model you want to apply to it when you get these really extreme things happening. If those things are happening as described, if they're kind of authentic reports, then that tells us some pretty startling things about the nature of reality and what's possible. And with the psychic surgery that you witnessed and participated in with your tweezers, was this all the work of kind of possessing spirits or spirit doctors or something? Was there any instances of people learning to do this and training in the same way that we would train remote viewing or clairvoyance or something? Or was it all external?
Well, the healers that are doing the psychic surgery, when you ask them, they all say they're channeling the Holy Spirit. And now they also, most of them are coming out of the tradition of spiritualism, the whole movement that was started by Alan Kardec, and, that the UK mediums even today very much still follow. So that's really interesting too. In my research just recently, I really gained an understanding of the connection between the Brazilian psychic surgeons and Philippine psychic surgeons and the spiritualists and physical mediums in the UK. They all did come out of that tradition from Alan Kardec, but they, when it gets to another country, they really change things up around. But they do say that they're channeling the Holy Spirit when they're doing healing. There's different stories of when the healers were children, like they would suddenly be overcome by something and someone would need healing and they would just, go and do it. And they didn't. So they very much felt like they were being taken over. And some of them do seem to go into a whole different state. Others will just seem like themselves and just be talking. But I went to a village. I got to be friends with a woman who her family was from the village where the first psychic surgeon supposedly was from. Well, this guy was from their village, and supposedly he was the first psychic surgeon that was at least known at that time. And it was this tiny little village. And on Saturday nights, you'd go to their one church where there's dogs and chickens running around, and they would do different training, like healing training. So they'd call it magnetic healing. So, and this would be for the children. The old people would teach how to do magnetic healing, and I went and did it with them. And then we had to get up and in front of everyone and what would be kind of like preaching, ministering, but while you're channeling. And so you're just supposed to just stand there and channel. And I started to I wasn't really seriously thinking I was channeling, but I didn't know what. I was just okay, I don't know what I'm doing, so I'm just going to let the Holy Spirit move through me. And I started to talk about pigs, you should stop killing your pigs. And the whole audience broke out laughing hysterically, it was the funniest thing they'd ever seen, heard. It was so embarrassing. But anyway, so we just did stuff like that. But the thing that really struck me was how sweet that was, that this is just what they get together every weekend and do these things. So, in that respect, there is definitely that development and training of the general people. But as far as the ones that go so far to be doing, I don't know if those healers did that training, but the training was very basic. It was just basically do this, put your hands on the person and, channel, stand up here and just speak. There wasn't much.
Was this the magnetic healing that was channeling as well?
The magnetic healing is, they call it magnetic, but no one explained anything. They didn't really explain it. They just called it that and said, put your hands here and let the Holy Spirit move through you. Some things I picked up, one healer that I lived with for a little bit, she would put her hands you'd lay down and she'd put her hands on your solar plexus, and she would just imagine that all the energy that needs to leave the body is coalescing right there. Because a lot of the healers, it's not they might just take 5 minutes with you. It's super quick. Yeah. So she said that she's visualizing and intending for all the energy to come from all the parts of the body it needs to, and it comes to the solar plexus and then releases there. And when she touches you, you do start to feel pain, it builds and builds and then releases. So I sometimes have incorporated that into my work with people. Or there was a healer called the Exorcist. He wasn't doing psychic surgery, but he had his own chapel, and you walk in and everyone's in the chapel area, and then there's a table up at the front. You lay down, and his wife would stand at the person's head, and then he would stand at their feet, and they would be yelling at the body, basically what they're doing. You don't know this at the time. They just are, yelling. And but they're yelling, and the wife starts laughing and starts burping and doing all this weird stuff. And you're lying there, because I had this happen. You're lying there what the heck is going on? And really what they're doing is yelling at the spirits to get out, and they're trying to pull the spirits out of your body, through yelling at them and laughing. But the very weird thing was, so when they were doing this to me, the guy, he stands at my feet. His name was forgetting his name, but we call him the Exorcist. David Olegani. He's no longer alive. He died some years ago. But at the time he was standing at my feet, and I suddenly like started to get like this terrible pain in my toe. Like it was so bad. And I'm thinking like, what is he doing? Like I was convinced he must have like, had a knife or something. And I start like kicking him because he like, just get away. I like, let me up. And then like all these people in the audience are watching this, and I'm like, oh my God, they're going to think like I'm possessed because I'm like kicking him, but it's just because it hurts so bad. And I got really mad, and then it was over, and I went back and sat down, and I was like, yeah, I don't know what happened there, but this was just so then but he was just like, I watched other people came up, and they were also like he was doing it through their feet, and like they'd be fine, and then suddenly they'd start screaming. So the next day we came back, I was with a group, and we came back, and I'm just sitting there, and he's working on someone, and suddenly he stops the healing, and he turns and he looks at me, and he's like he goes like that to me. I'm like, me? You want me to go up there? And so I did, and he told me to stand at the person's feet, and he had me take one finger, and I just like gently put my finger on, like if this was a person's toe, I just like gently just touched it there, and then he held my hand, and then he started to do his like yelling at the spirits and stuff. And this was somebody who had not been there the day before. They hadn't seen anything going on. And sure enough, like after a minute, that person just starts screaming and saying like there's pain coming out of their foot. And it was like almost no pressure, but he was holding my arm. So that showed me something, because he was definitely not using any kind of, knife or anything. And then the other weird thing was when I got back home, I was working with one of my friends. We were in a healing class, so we would do a lot of different exchanges. And I was just like working in her aura. And then suddenly in my head, I heard the healer's voice, like where he's saying, like basically he's saying in Tagalog, but he's saying, "Get out, you demon, get out." And I heard myself saying that, but like to her. So I thought, oh, maybe I'll go like just kind of work over by her feet. And the second I put my hands there, sure enough, she's like, "Oh my God, what are you doing to me? There's this like terrible pain coming out of my feet." So yeah, that, it's things like that where I'm very skeptical initially, but then having these experiences and the verification, starts to help that there's something going on. But getting back to your question, one of the reasons I went to the Philippines was because I wanted at that time to learn how they did to do what they did, and I was really, and I had just come out of, I had been working or training at the Berkeley Psychic Institute and some other institutes in Northern California, where we did learn techniques and approaches, just like in remote viewing, where, there's methodologies. You could say, do this, and then you're going to have results. So that's what I was looking for when I went to the Philippines. And I was very disappointed on that front, because after spending time with so many of the healers, they really couldn't articulate too much more, than that they're channeling overall. Besides from like, what I've just told you is pretty much like the extent of what I learned from them there. That's about it. So yeah, didn't learn too much more.
So Daz, your recent remote viewing project on that psychic surgeon guy, can you talk about this, or is it super secret? Because this will be coming out in a couple of weeks as well, so I don't know when it's been released.
I have to be very honest here in that I do so much remote viewing, I cannot remember anything about it.
Okay, do you know who the healer was? Did you choose the healer yourself, or were you a viewer?
No, it was a blind target. It's coming back to me a little bit. It's a famous 1970s psychic surgeon, and he was found by the guy that found Yuri Geller. I can't remember the guy's name now. Pucherich. Is it Regio or something? His name or something?
Oh,
I think he's Brazilian or something.
yes, yes. That He's a Brazilian healer. Puharich did write about him, and
Yeah.
he was he in Brazil. The way they do their psychic surgery is they're actually using physical instruments like rusty
Yes.
knives.
That's it. The book's called something like The Rusty Knife Psychic Surgeon or something like that.
Yeah.
I vaguely remember. I'm just trying to see if I can find it now. I remember my data was 90% about how it was all fake and manipulation. Yeah.
Oh no.
That's all my data was about. Yeah.
Oh no. And it was a blind target.
It was a blind target, yeah. And I was talking about how these people were putting off this fake manipulation and faking people. I vaguely remember that now.
I would love to see your session.
Amigo is, yes. So I'm just going to have a look at here. I'm going to put it up here. I mean, I could even show it if you guys wanted to see it, I guess.
Sure. Yeah.
We can share a screen, can't we? It's not very good for the people that are listening, of course.
Well, we could just do it quickly and talk through it.
Yeah.
Okay. Let's have a look then. I've never done screen share on this, so let's see how we do this. Entire screen. Let's do my screen over there.
The thing about him, Puharich wrote extensively about him, and he said that he was extremely accurate in his diagnoses. Like, even though he barely had an elementary school education, that he was able to give like extreme, using like medical lingo and extremely accurate and detailed descriptions. So that was another reason he was supposed to be impressive.
All right, so bear in mind, you literally just pulled me up on this. I'm almost forgotten what I did here, and it was done on 19th of March. So the target was the Arigo, I think, Arigo, Rusty Knife Psychic Surgeon or something. Yeah, he's known as. And so I was getting this energy here, effervescent energy with psychic expansion to it, but it was quantum at the quantum level, so it felt like there was many smaller parts moving in concert, a flow, a dance, a universal pattern. And there's me trying to draw this energy, microscopic particles moving, swirling. So I actually did get some data that kind of indicates maybe something weird going on there. Like this was like an elemental type of energy. Fluid momentum to this, feels very intangible, like a hidden force feel to it, a universal constant. And it also had a time element to this and gravity, super large universal forces being involved in influencing the target. So yeah, I did get some stuff that does fit, I guess. Then I had a life form here, a male involved, but I had future events. I kept feeding that there was some kind of future kind of thing here, but also some symbolic data. And I was getting all this weird thing about vibrating strings. Vibrating, so this is like almost like, and it felt to me, I don't know anything about string theory, but it felt a bit like quantum strings or something, whatever you'd call that. I don't know, because I don't know what I know nothing about that kind of stuff. And I wrote here, I look like I'm looking at multiple time streams, strings or roots or possibilities all vibrating. And this is all to do with sound frequencies. It felt like a future target, which it wasn't, but it felt very fluid and not real. Organic, but also constantly changing, like an embryo of time. And then I, wrote the what the fuck there, because I was like, what? I've gone off on a high one here. Just it feels like I'm being shown a process, guided to view a process. So I asked why. Life, target affected by other things I'm being made aware of, and it was all about vibrations, frequencies, energy, and faults. A flash image of psychic manipulator here. So a male over 40s, dark skinned, foreign to me, and he's aware. He's subtly influencing or nudging the situation. This doesn't feel like an actual target. So I wrote here, this doesn't feel physical. It's like an illusion or mirage or being holographic. So although I was picking up stuff that felt like it was real and physical psychic stuff, I was actually picking up stuff actually that made it feel like he was faking something at the same time. And I wrote here, it feels manipulated. Something isn't right. There's more than one person involved in a deception. It's like a diversion. And they're deceiving. They're like changing an outcome here as well. Target feels guarded, manipulated. And that's, pretty much where I ended it. So I would say half and half on that one.
Wow. And what about your smiley face? I always pay attention to your smiley faces at the end.
I always do those at the end of every session to see, to kind of indicate if I feel good or bad about the RV session. Yeah.
That's the first one that's not look so good, like not look so happy.
I get some quite not happy ones on future events and on the crypto ones we do as well. Yeah.
Well, the other guys did work that target too, so we'll link to. There's a video on YouTube that I watched. I haven't got to watch the full project yet, but there was like a preview thing that I saw yesterday, I think. So we'll link to it in wherever it is, somewhere.
I'm sorry, guys. I literally completely forgot about it. We do so much that one target comes in and another target goes out. I don't, if I get people say, "Oh, what did you think about this target you did 6 months ago?" And I'm like, well, I have no idea what you're on about.
Yeah. Well, that's really fascinating. Thank you for sharing that. Yeah. It's just like one more window of insight into something. And, we have to, especially that you did that blind, we have to take that into consideration. Although,
but like you, Debra, I have encountered, and I've done it myself, real psychic healing, which I've actually seen physically in my own eyes work. And, I felt it work myself. So I do believe there are true things out there that does work on those levels. Maybe not so much as the ones with the, the rusty scalpels and stuff, though.
Yeah, it was really amazing reading about some of these Brazilian healers because, it was really disturbing, but, they would like one healer, I don't know if it was that same one, but like he would make an incision and then spit into the incision to show that when the energy is high, like people can't get infections, they can't like, not all that goes out the window. So they had like no sanitary conditions, and someone would receive the procedure and then they would just like stick them outside with everyone passing around, and here they just had their bodies cut open. And the researchers that did report on it did say like they did some follow-up with people like who had those kinds of, really unsanitary conditions, and they seemed like they were okay afterwards, but there's a lot of lack of follow-up because people just go away, in these countries too. It's not like they even necessarily have cell phones or, so it's really hard for researchers to do any long-term studies to see, how they're doing. Sometimes they do consult with their physicians and things like that, but just in a very limited capacity.
So you mentioned, just before we move on, what's your experience with psychic healing?
Well, as Debra was talking about spiritualist churches, I grew up I essentially grew up in a spiritualist church. My mother ran the local spiritualist church for many years. And in fact, she even married me in a spiritualist church, which is the most bizarre thing whatsoever, to actually have your mum officiating the ceremony in front of you. Yeah, so I grew up in a spiritualist church, so I saw healing, every Sunday I saw people go through that kind of thing. And, you kind of wonder whether it's true or not, or whether it's a placebo effect. Then I trained in it myself, and I had a couple of experiences of giving healing to someone who said that, that made them feel completely better, but also receiving it. And, the person that gave me healing didn't even touch me. Their hands were hovering like about 4 to 5 inches away from my body. But the next day, the muscles in that area where they allegedly gave me the healing were completely on fire and stuff. And so that was what convinced me at the time and ever since. I've read other stuff as well, like, the fact that prayer works, and, we know that, that you can self-heal yourself and all that kind of stuff. So I truly believe it works. I just don't think we've got enough scientific data on it yet. It's one of those, one of those unknowns. So yeah, I've experienced it and seen it for many years.
Yeah, that's so fascinating. I didn't know that about your background. There is quite a bit of scientific data on energy healing. There is a lot. I haven't read most of it, but I would say like William Bankston, who was the president for over a decade for the Society of Scientific Exploration. He's done such fascinating work with healing mice, like where they infected mice with cancer cells, grew tumors, and then they projected healing for some of the mice and not for others. And those mice got better and sometimes lived way beyond their lifespans. And this was very well. He did it across multiple university medical labs just to show that it wasn't like one lab where people were, faking it or making errors or something. So I'd say some of his research is some of the most impressive, and it can be found online, William Bankston. But yeah, when I first started to train in doing readings and healings for people, that this was how because I was very, very skeptical, and no one like told me what energy healing was before. Like I just kind of got thrown into classes where they were doing it, but I would be sitting across from someone, like this was in person, but my eyes would be closed. And like the first woman this happened to, I remember like I saw this like woman, like this dark red energy, and this woman who seemed like her mother, but she looked like this evil stepmother kind of woman. And it was like she was putting something like ropes around her daughter's throat, who was sitting in front of me. So when I saw that, I was like, oh my gosh, this looks terrible. I'm not going to even ask her. Usually I'd ask someone if they wanted healing work, but I just started visualizing, like taking away those cords from her throat. And while I'm doing that, like I'm just sitting there with my eyes closed, not moving at all, she starts like saying, oh my gosh, like, what are you doing? Like, I just had this sense of like hands, like pulling something off of my throat, so it was just like constant things like that over the years where I'm doing something that I'm not telling them what I'm doing, but they feel it. They're reporting it in real time or afterwards. Same thing, I mean, I've had like hundreds and hundreds of energy healings from other people just because a lot of times it was like we're practicing on each other. And, then also just, going from like just feeling so terrible, like I could barely move to, the next day I'm totally fine. But yes, there could definitely be, the placebo effect is always a possibility. And, there's a lot of research going into what is the placebo effect, because even that, it's, a healing effect in a way. It's just like, it's just a mental thing. There could be, a lot more to even that than we know. But you can, it's pretty much, you could never totally rule that out. At least it's like a partially there. But yeah, when you get the independent confirmation, I think that you can have a little more.
I think studies where the healing is remote and everybody's blind to what's going on, you can rule out placebo.
Yeah.
Although maybe then you've still got an experimenter effect, which is it's really hard to unpick these things, isn't it?
I think there's the best book I think I read on it was The Field by Lynne McTaggart. I think she details quite extensive, really in scientific protocol experiments in remote healing in that book, which were astounding. Yeah.
Yeah. She just did an interview with on the New Thinking Aloud with and talking about her research. It was a really good interview.
Awesome. Yeah.
I'm always happy to see she's still doing her work because she's been around a long time now. But
yeah, a long time. I was going to ask you a question because you mentioned you're a twin, and I think you mentioned that to me in the past. Do you ever have any of the classic psychic twin experiences with your sister? And has she also gone down the same pathway as you with like a psychic lifestyle?
Yes, yes to both of those. That was really. I attribute like my early interest and awareness in all of this to our early experiences that we had. And, we would just be pretty much telepathically communicating all the time. And it would almost be hard to even talk to other people because I would be about to say something and she would just say it. And, I would start to feel like, oh, why am I even bothering, saying anything? Because she's going to say it anyway. We'd have that. And then I became very aware at an early age that I would be feeling her feelings many times. Like if I'm feeling good, usually I'm not too much of an anxious person, and she has a lot more anxiety. So if we were apart and I suddenly started to feel anxious, then after a while I was like, oh, something's up with her. And, sure enough, she'd show up or call and be like, oh, I'm so anxious, this just happened. So that's where I really realized at an early age that, our feelings, our thoughts are not our own a lot of times. I mean, it's tricky because sometimes they very much are our own, but, learning the discernment is important. And, sometimes it's pretty intense. If we get mad at each other or something, like I'll feel like I'll get a pain like boring into my head, and I'll be like, oh, that's my sister. I guess we need to talk through something here. And I've had just some really bizarre experiences where usually like I don't, these things like stay within control, but I had this one scenario where years ago my son was going to be in a robotics competition, like in this gymnasium, and I was driving there. He was already there. He was in high school with some friends, and on my way there I was getting like these impressions of like a person being like tortured, like like an adult torturing kids, and I kept like getting these impressions as I'm driving there. And by the time I got there, I was like, oh my God, is someone here like a child torturer? And I walked in and I'm kind of looking, like checking people out. I saw this one creepy guy and I'm like, maybe it's him. And I just started to get like so anxious and overwhelmed, and which is not like me at all. And I at some point I was like, okay, something's going on. Like, this is not my energy. This is not me. Because I even told my son, like, I think I'm going to have to go. Like, there's something wrong with me. And there was I think it was like exaggerated though, because there was so much energy in the room. Like all the kids are running around with their robots. And then all of a sudden it dawned on me, check in with your sister. So I texted my sister. I'm like, what are you doing right now? And then she texts me back and she's like, oh my gosh, I'm in this class and I just had this therapy session with this woman. And then she calls me and she tells me, she's like, yeah, this was really intense. This woman, when she was a teenager, she was kidnapped for a month and tortured. And we just did this whole processing. And I kept telling her, you have to meet with my sister. Like she'll do a reading on you and help you get over your trauma. And, is it okay if I give her your number? And I was like, no, don't give her. You already went through that whole like scenario, in my head. But so yeah, it was like I was experiencing their whole therapy session. And usually I wouldn't like lose control like that, but it was, I think being in that crowded environment and not being able to tell, what's going on here versus within myself. But it's things like that we've just had these experiences our whole life. And we've even communicated to each other in dreams. Like one of our early substantial experiences were I had been out on a date or something. I came back. We were sharing a dorm room in college, and she was lying in bed and she was having this night. I could tell she was having a nightmare because she was tossing and turning. And I was about to wake her up, but then I thought I'd do a telepathy test. So I just like sat in my bed and projected to her. I said, if you can hear me right now, then raise your hand. And if you raise your hand, then you'll wake up. And I kept sending that over to her, but like nothing seemed to happen. So I was just like, okay, that didn't work, and just got in bed. And she woke up a minute later and she was like, oh my gosh, you wouldn't believe this dream I just had. She said like there was some creature and it was like holding her down and like attacking her, and she couldn't get away. And then she saw me walk into the room, and I told her, raise your hand. If you raise your hand, then you'll wake up and this will all stop. So it actually like got incorporated into the dream, which I thought she was going to, physically do it, but instead it happened in the dream. And she said when she lifted her hand up in the dream, it worked. And she told me this before I told her what I had done. We were both totally freaked out after that. So, yeah. But
That's a great story.
she does, she is doing like professional psychic work. She has for many years. She works a little different than I do. And she's learned a little bit of remote viewing as well, but not like really formally trained. But she does a very interesting process that I think there's pros and cons to, but she like will use her whole body and let her body take her to different places to get information and let like the information work through her. So, for example, I did invite her when we were working on the Idaho student murders with my group with Nancy Smith and Sublime. We had talked about it at a conference, but several students had been killed at a house on campus at I think it was Idaho State University. But they, so everyone was trying to find out like who killed them. And so we were working on a case. We had connections with one of the investigators. And so I asked my sister if she wanted to help. And so my sister used her procedure where she's just kind of walking around trying to get like signs as she, basically she'll like go outside and just look to see if something draws her attention, and then she'll make notes. But what happened was, she was doing a reading for a client, and the client was saying like her boyfriend's name so they could like tune into the boyfriend. And I think like the guy's name was, I don't remember what it was, but my sister said she kept calling the guy the wrong name, and she kept calling him Brian. And her client was like, why can't you remember his name? That's not his name. And then afterwards, my sister wrote to me and she said, I kept calling this guy Brian, and I've been obsessed with the target of what we've been doing here. And so I think that the perpetrator's name is Brian. And so I sent that into the manager, and then sure enough, the person who he's still like undergoing he's still undergoing court cases and stuff. I don't think he's been formally convicted, but his name is Brian. So yeah, and there's not really any question that he did it. It's just he's gonna, still try to get off. So, she was correct in that. I got the guy's I wrote that the guy's father's name was Michael, and as it turned out, his name was Michael as well. So, but I did mine through like traditional remote viewing, and she did it that way. But she's a photographer as well, and she uses this to like be in the best places. Like she went to Austria, and she said she was just like kind of looking around at her window, and she saw a picture of like a retarded guy. And then she then also saw an announcement that there was going to be a film festival. So she took her camera, she went to the film festival, and then she looked around for someone that looked like they were like mentally, what's the official word, like developmentally disabled, but with Down syndrome. And so she then went and positioned herself right next to the person with Down syndrome. And guess who walks in and walks right up to that person and shakes their hand, so that my sister got like the best shot with her camera. Guess who it was? It was the president of Austria. Just walked straight in the door. She had no idea he was going to show up, and he just was like, oh, there's this guy in a wheelchair, let me shake his hand. And she got all the pictures. And if you go to her Facebook page, like you could see, she has pictures of Prince, Prince Charles' son, the one that's in America now, and living in Santa Barbara. So the prince and princess, she has pictures, just everybody, and that's how she's using her psychic abilities. The only downside to that is that she gets a lot of extraneous data, and like when she in her session, she had like, it was like 100 pages long of like I saw this car, and then I saw this, and then this happened, and I was just like, I
I mean,
can't.
is that even usable to have? Because that's the last thing I want. I want like a half-page executive summary. I don't
Right.
want 100 pages of anything at any point. Like, how do you work with that?
No, you can't. So I told her, you know, you got to find a way to hone it down to what you think is
Yeah.
most important and not provide this extraneous thing. Because even one session that long, like no one has time to go through, and there's just going to be
Yeah.
too much to sort through. So, my hope is that I mean, she is super psychic. So my hope is that, she can kind of get that procedure down in a way that's
Yeah.
more efficient,
Yeah.
for sure.
I think I've heard that. I've heard that approach called omen walking
Women,
for just, yeah, or omen driving. You can do as well.
yeah,
Yeah.
it's cool. I've had, a couple experiences. I think it's really we all have this operating in ourselves, and it's probably a survival mechanism and how we've all stayed alive. Like I've had a couple times. One time I was in Hollywood driving around in traffic, and I was like in the middle lane, and suddenly I just had this urge to get over into the next lane. And I had no logical reason to do that. Like both lanes were equally as crowded, and it took a lot to maneuver in there. And I'm like, why am I doing this? And then as soon as I did, I hear a loud sound, and a car crashed right into the car that had moved into my space. And that would have been me if I hadn't moved over right then. And it wasn't like I heard something, move over. It was just this like feeling in me, like I have to move over here. And I think that that's how probably, why do we ever, go left instead of right? We have our routines, but when we break our routines, we may have averted so much danger and
Yeah,
chaos.
and we never know as well. We
Yeah.
never know what amazing things have happened. I had one like that where I had like a knowing to pull over to the side of the road, and there was nobody about. I started to feel silly. I was like, "Oh, am I imagining things? Am I going crazy?" And then this car came flying around the bend. We would definitely have collided, and there was a blind corner. I couldn't see them or hear them or anything. And I was just sitting there waiting, like, at what point do I doubt myself? And then, I was sure.
Yeah.
Sorry, Taz, you were going to say something when I.
No, that
I was just going to comment on Deborah's sister's creative process because, being a photographer myself, I find, and being a creative all my life, I find that, and I think the reason why I'm so good at getting logos and design for people is because I use, psychic ability to kind of get into the headspace of the person that, I'm designing the logo for. And for my photography as well, I get, I'm getting really good shots. But I think it's because I kind of know to be in a certain place at a certain time. And then 5 minutes later, a certain person is going to walk around the corner to give me the shot that I need. So I totally understand that. I truly believe that creativity and psychic intuition, for me anyway, the data feels the same, and it feels like it comes from the exact same place.
Yes, exactly. Yeah, I've seen so many of your photos, and I'm constantly amazed. I'm like, oh my gosh, how did he get that one? Makes total sense.
Yeah, it's definitely an interesting thing, and the fact there's so many known or well-known good psychics as well have a very creative lifestyle about them as well. So there definitely is a solid connection there with what your sister's doing.
A lot of very creative people in the sciences as well, and like Nobel Prize winners and stuff, all the mathematical geniuses and physics geniuses who make these great discoveries very often play a musical instrument to a high level, or an artist or something. There's this real coming together of intellectual and artistic and creative and psychic stuff, isn't there?
Absolutely, yeah.
And so many directly attribute their dreams, or, Einstein talked quite a bit about his clairvoyance and how important it was to him.
Yeah, Edison and Tesla are two other well-known. Well, I think Tesla, it was less voluntary, and Edison was more of a dabbler, wasn't he? But
yeah, Well, and Mark Twain, he was one of the early members of the SPR, and one of my favorite books. It's very, very just basically like a pamphlet that he wrote on, he called it Mental Telegraphy. And it was all about his course of discovery of how his thought systems were not just his own, but made up of what other people were thinking or trying to communicate. And he has these fascinating stories where, like, in those days, communication between people, especially overseas, would take months because letters had to, go across a ship. And he said, like, the very first time he realized that he was receiving intuitive communications was he just started to, like, think about a project. It was some kind of research project that didn't really have to do, or writing project that wasn't something he would typically be interested in. And he said he was obsessing about it. And then he thought, no, this isn't for me. This should be for this other guy but this other guy he hadn't talked to in 10 years. And he was like, I got to talk to him. I'm going to write him a letter. But then he was like, oh, I should secure like a publisher for him first. So he waited a little bit. And then a letter arrived from this guy, he was in like the UK and the other guy was in the US. And the letter arrives, and the letter is outlining the very project that Mark Twain had been obsessing about. And the guy is asking him to find a publisher for him. And so that started like pretty much a lifelong paying attention to these things. And he had several other things like that happen. And he said, like, people he knew, like, started to come to him and ask him, like, basically giving, intuitive input because he, so much recognized this. So this was like such a big part of Mark Twain's life. And I never realized that until recently.
Yeah. Oh, I didn't know that. That's really cool.
Me neither.
So he was like a literary psychic.
Yeah.
Right. Had a real niche.
It was interface.
Ooh.
Oh,
Blackout.
yeah, we're still here.
Yeah, at the most opportune time.
That was coming in saying, oh, thank you for mentioning.
Yeah, you never know. Yeah.
It does occasionally happen, doesn't it? So I think Mark Twain being a literary psychic is a good segue into part 2 of this interview, which will be out in a little while. We'll link to it here when it's released, and in the meantime, be sure to check out our other episodes. Thanks.
Messages. I don't believe our souls penetrate mind-sucking aliens. Have you ever felt like this? Right? Have you ever had the electricity right up your ass? There's something that started to